Okay. Hi, welcome. My name is Melissa. Today, my group and I will be discussing the issue of the lack of access to equitable healthcare in Indigenous communities in Canada. So, our initial article outlines the shortage of nurses in these Northern Indigenous communities and how the healthcare system has failed to meet the needs of these individuals. Now, it should be noted that this article discusses concerns related specifically to the coronavirus. We're looking at the broader issue here, not just in the context of the pandemic. So we're sort of using this article as a jumping off point to explore the long-term implications of this shortage. So why this presence of health disparities in these areas? One of the reasons is structural barriers and a lack of infrastructure. So at the most basic level, things like transportation systems, access to water, these things are not up to par in these areas. There's a lack of funding from the federal government, and as well, there's a lack of culturally relevant care. Healthcare here needs to be constructed and reformed into a way that maintains the cultural integrity of these individuals. It needs to strive toward incorporating Indigenous ways of knowing and their core beliefs and values in relation to health so that it serves them better. I have a quote here that illustrates how these issues impact the general health of the community. And it says that this lack of resources have resulted in children not being immunized, children's growth and development not being well tracked, and even things like cancer screenings falling through the gaps. So why is this important for nurses? Well, nurses have the opportunity to fill this gap in primary healthcare and to contribute to better delivery of care. It also generates really important conversation among nurses about what an Indigenous-centered approach is to healthcare so that we can act as advocates for the individuals in these communities in order for them to have the quality care that they deserve.
The first article we found to support our research is titled Challenges in Health Equity for Indigenous Peoples in Canada. The author mentions rates of health among Indigenous people that highlights inequalities, including higher rates of infant mortality, youth suicide, exposure to environmental contaminants, and many, many more. The authors believe that the social detriments of health approaches remind us that Indigenous peoples' health status reflects the socioeconomic, environmental, and political context of their lives. They remind us that Indigenous peoples in Canada live with many disparities, including higher substandard and crowded housing conditions, poverty, unemployment, lower education levels, and less access to quality healthcare services. And that the causes of these disparities involve historic and ongoing impacts of residential schooling, loss of traditional lands, aggressive social welfare policies that remove children from their families, and many other marginalizing and traumatizing governance policies. The authors believe that equitable access to high quality and culturally respectful health services for Indigenous peoples is essential to address these disparities and transform Indigenous peoples' health. And that to improve our healthcare system, we must change practices, policies, and structures at multiple levels, including medical education, funding and jurisdiction, service delivery, and infrastructure to make them respect the culture of those being served. This will help create equity, safety, and respect in the healthcare system.
The second article we found to support our research is called Understanding Access to Healthcare Among Indigenous Peoples, a comparative analysis of biomedical and post-colonial perspectives. The authors suggest that the best way to understand why Indigenous peoples lack access to equitable healthcare is by combining both the biomedical and post-colonial theoretical lenses. They feel, as we do, that the biomedical lens alone is too simplistic, places blame on individual people, and ignores the social and historical contexts that shape health and wellness. The addition of a post-colonial lens, grounded in critical social theory, assumes the impact of structural racism and inequality, and casts healthcare as more than just a service, but as a social relationship in which power is not evenly shared. Through this paper's analysis, we can see that addressing Indigenous healthcare inequality in Canada is not just a matter of individual and physical solutions, such as subsidizing costs, but of decolonizing healthcare delivery itself, particularly at the nursing level where so much patient interaction occurs, and of creating culturally safe healthcare spaces.
The issue of lack of access to equitable healthcare in Indigenous communities in Canada is addressed using the social justice advocacy theory in the article. Social justice theory aims to establish fairness, ensure equal access and equal treatment for patients, and in healthcare, it means ensuring everyone can maintain their highest level of health and wellness. As stated in the article, there is limited healthcare personnel, and Dr. Marilyn Cover stated that Federal and provincial healthcare authorities should increase the health personnel to the indigenous communities to help in improving their well-being and health. Quality healthcare system is what's missing, and indigenous people are the ones that are left out. They do not get quality healthcare, which leads to chronic illnesses, high rates of infant mortality, obesity, and diabetes, exposure to environmental pollutants, and youth suicide. This could all be improved by increasing fundings for nurses in these communities, building trust between the indigenous communities and the healthcare system, ensuring nurses, encouraging nurses to work in these communities and in a respectful way, creating supports and funding to help people in the communities get education and become good healthcare workers, especially nurses who can then help their communities. By doing so, we'll also be ensuring that there's no difference in how Indigenous and non-Indigenous people are being cared for.
A number of cultural considerations can be identified for nurses and other healthcare professionals within the Indigenous community. Some examples are, but are not limited to, the lack of trust towards healthcare providers, lack of respect towards Indigenous people, and trauma from past experiences. It's essential for nurses to be aware of culture and its importance in the profession, especially for Indigenous communities. Nurses must apply the concepts of cultural competence, cultural safety, and cultural humility when providing care in every health setting and not only in hospitals located in the First Nation territories. This brings the discussion to marginalization. Aboriginal people have been marginalized and isolated from the rest of the Canadian population for a long time, and it is now only starting to get better. If nurses are able to implement the cultural concepts into their care, they will be able to minimize any feelings of neglect and promote the best practice possible for each of their patients. Active advocates of the Indigenous population in healthcare are missing in relation to this health concern, as well as the lack of Indigenous healthcare providers in hospitals outside the First Nation region. Although there is a high nurse demand in Aboriginal communities, further education and recognition is also greatly needed. This could then lead to a better understanding of cultural concepts within the Indigenous communities, and that may encourage nurses to work in these communities to develop deeper cultural awareness.
When it comes to the lack of Indigenous healthcare, nurses are tasked to raise public awareness and support on this issue. As you turn your attention to this picture, you can see there is a group of individuals outside a theater excitedly lined up to watch a movie called A Reassuring Lie. You will also notice that not a single person is in line to see the other movie, An Inconvenient Truth. This is representative of the idea that ignorance is bliss. Much like the individuals happy to be fulfilled by a reassuring lie, healthcare providers, the government, and non-Indigenous citizens are happy to ignore the issue of Indigenous mistreatment by choosing to live blissfully unaware, as opposed to investigating further into the issue and having to address an uncomfortable truth. A potential future implication is if and when adequate healthcare resources are provided, many Indigenous may still be hesitant to seek medical care because of past negative experiences. It is crucial to recognize they have a past, one that has caused many of them to be fearful of seeking healthcare. Nurses must be sensitive and aware and apply a trauma-informed approach that respects these fears and makes them feel safe enough to seek help when needed. Although there is a shortage of Indigenous nurses, by encouraging the few there are to advocate could be beneficial in recruitment. This would provide insight into their unique experience and allow the Indigenous population to have a sense of cultural safety, as well as provide a gateway for direct involvement in addressing healthcare inequity. Overall, advocating and raising awareness for the Indigenous population is an action nurses must perform as both leaders and advocates aiming to provide patient-centered care that promotes both equity and equality in a respectful and sensitive manner. So that concludes our presentation. Thank you for listening.